Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and today I'd like to share with you Rockstar Hygienist trait number 11. We're almost there, almost done. Rockstar Hygienists start on time and stay on time. So you've probably heard before that a 60-minute hygiene visit can be broken down into 3 equal parts. 20, 20, 20. Not necessarily a new concept, but let's talk about how this is broken down if you have the luxury of having 60 minutes for all your adult, prophy, and perio maintenance patients. So the first 20 minutes is for the hygiene exam. This includes your x-rays, your perio charting, photos, oral cancer exam, medical history review, all those things that you do as part of the hygiene exam. This also includes the time that you greet the patient, if you're going to represent any treatment. This all happens before we ever pick up a scaler. Remember, 20 minutes. The next 20 minutes is our time for scaling and polishing. We're going to come back to this in just a second. And then the final 20 minutes is time for your doctor exam, scheduling the next appointment, turning over your room, the handoff, and all that. So as you can see, there's a lot packed into this 60 minutes. And what I know for sure is that if you have this time, if you don't use it, you will lose it. Something will happen. Either doctor will decide to shorten the time, admin team will decide to shorten the time, so be sure you're using this time. Now, the number one reason that I have seen for running behind on a hygiene visit is too much scaling. So that's this portion right here, right? 20 to 25 minutes. Remember, we talked about the scale and polish. I heard recently about something called Parkinsons Law, and you can Google it. Parkinsons Law states that work expands to fill the time available for its completion. So if you think I have 60 minutes and all that time is going to scaling, then, I mean, there's always another surface that we can scale. There's always another little speck of calculus or a speck of stain, rather, that we can remove, right? But if you know I have 20 or 25 minutes, it's amazing what you can accomplish and what resources you will find to help you get that done, like your ultrasonics. So I've tested this. And, you know, if you're routinely spending more than 20 or 25 minutes on your scale and polish, that patient probably needs something other than a prophy. Okay, so here are a few tips to help you stay on time and make the most out of the time that you have. Number one, and if you watched the previous video, you heard me talk about this, is properly identify perio. So remember, we said if you're spending more than 20 or 25 minutes, that patient probably needs something other than a one-visit prophy. You know, we'll talk in just a second about what if they have a lot of stain, but periodontally they're healthy. That's one situation. But if we're spending a lot of time scaling, we're going deep subgingival, there's bleeding there, then that should be a big red flag for you that something's going on. There is some inflammation or some infection there that we must address. And when we do that, then we can move the patient into an appropriate appointment where we have plenty of time to properly treat them, make the diagnosis, properly treat them, and help them get ready. So help them get healthy, excuse me. So I worked with an office recently, and we timed their hygiene appointments. And one of the things we looked at was how much time was there between when the patient was seated and when scaling began. And with this team, it was an average of 3 minutes. 3 minutes from when they sat the patient to when they begin scaling. So there's no way that we can do all of that assessment that takes place in that 20 minutes in 3 minutes. So please be sure that you're allowing and devoting that time at the beginning of your appointment to all your data collection and your assessment of whether they have disease or whether they're healthy. And a lot of these patients were also being dismissed about 10 minutes early. So guess what? The admin team started crunching the appointments, shortening the appointments, because the hygienists just simply weren't using the time. So be sure that you're properly identifying perio. Number 2 is call your doctor early. So if you hate waiting, and doctors, if you feel rushed at the end because your hygienist maybe is calling you at the end, and maybe that's what you've asked them to do, give your hygienist permission to call you as soon as they finish all their data collection. And hygienists, same thing. Call as soon as you finish that exam. Before you pick up your scaler, let your doctor know you're ready, and then you can work while you wait instead of waiting till the end and then it gets all stressful. Okay, number 3 is talk while you work. You have your patient's undivided attention while you're working in their mouth. So if you perhaps found a restorative need that you identified in that first 20 minutes, or there was incomplete treatment that you revisited, then obviously there are times, like when you're presenting treatment, that you want to have the patient sitting upright. But once you've done that and you're sitting back to work, that's a perfect time to elaborate on what you have found, or continue to refer back, leave that picture up there and just continue to tell them. Maybe you're talking to them about their risk factors, or you're talking about the connection between periodontal disease and heart disease. And of course you can have a little fun with the patient there too, but this is an undivided audience, and this is going to help you stay on time, is to multitask and talk while you work. Use this time to educate and enroll. And then the next tip, number 4, is to set realistic expectations. So Dr. Bruce Barrett, I've learned so much from him, and one of the things he teaches is to handle the objection before it becomes an objection. So if the patient comes in and they have black tea stain on the linguals of all of their teeth, you've seen it, then we need to set their expectation for what we can accomplish that day. Now, I grew up and I started my first job in a town that was built on textiles and tobacco. And we had so many smokers, and they would come in, and it was just that, like they had that nicotine stain along the linguals of all of their teeth, or they smoked a pipe. And you remember, I never see patients like that really anymore, but I remember that thick, sticky, waxy stain that would take forever to remove. So let your patient know ahead of time. Take a photo, show them what you're seeing, and say, here's the deal. We've got a certain amount of time allotted today for you, and we're going to have a couple options. I'm going to do the best I can and get as much of the stain off as I can in the time that we have. And, we can either be happy with what progress we've made, or if you'd like me to work on it more, then we'll have you come back. So spending, an hour and a half on that stain and making the next patient wait just doesn't make sense. So, we all run behind from time to time. But using these tips will help you stay on time more frequently and reduce your stress.